Yeah, I wanted to talk a little bit today about the use of Propecia in hair loss. It seems in the last year or so there's been a lot of controversy about whether or not Propecia is actually good to use because it potentially could cause some serious long-term side effects, which isn't necessarily true, and I wanted to kind of clarify these bits of misinformation that you may have heard. Statistically, if you're under 50 years of age, between 20 and 50, about 90% of the time it will stop you from losing more hair, essentially. The opportunity for regrowth or thickening of hair is about 60 to 70%. So there's a big upside there. And as far as the downside, what about side effects? Well, these studies were done on 18,000 patients, so huge numbers here. So the statistics are valid. The side effect rate was about 5% or less. That's pretty generous. It's probably about half of that. The most notable side effect was sexual dysfunction. So guys complained of decreased libido, trouble getting erections, that sort of thing. And the monograph from Merck says that these are reversible side effects. And in my experience prescribing Propecia for the last 14 years, that's true. Simply put, all Propecia does is it lowers a hormone called dihydrotestosterone, or DHT. It doesn't bother testosterone levels at all. If you lower the DHT levels and a person experiences these side effects, and then you take away the medicine, the DHT levels will go back to normal. There is no permanent drop in DHT. So DHT levels go back to normal. That person should resume and achieve their normal sexual function again after this cycle goes through. There have been patients that have lost sexual function after taking Propecia, and then it didn't come back after discontinuing that. These are likely patients that have had predisposing factors for impotence and sexual dysfunction, such as low testosterone, hypertension, diabetes. You start taking Propecia and it really kind of pushes them over a cliff they were heading over anyway. So when they stop the Propecia, they really never recover their full sexual function because, they already have other reasons for that. It would have happened anyway, regardless of whether Propecia was in the picture or not. 1 milligram of finasteride taken daily can help to maintain your existing hair, can actually help to thicken up your hair in all areas where you have miniaturization. But most of all, it's just good to keep what you have. So I hope this clears up some of the questions that people have. If you have any concerns or specific questions about Propecia or other hair maintenance medicines, you can contact us at the Northwest Hair Restoration. I'd be happy to talk to you on a phone consultation or answer your questions by email as well. Thank you.